Welcome students. Today's chapter is anatomy of cardiovascular system. That means heart, covering of heart and blood circulation of heart. Okay. So cardiovascular system of heart, its anatomy. First of all, the heart is the size of your fist. The size of your fist. मुट्ठी के बराबर. कहाँ पर है, लोकेशन कहाँ है हार्ट का? सुपीरियर सरफेस ऑफ डायफ्राम, लिटिल लेफ्ट टू द मिड लाइन ऑफ द बॉडी, एंटीरियर टू द वर्टिब्रल कॉलम, पोस्टीरियर टू द स्टर्नम. वर्टिब्रल कॉलम के आगे एंड स्टर्नम के पीछे. क्लियर? नाउ आई विल टेल यू इन दिस डायग्राम. यू कैन सी this is the heart. This is slightly to the left side of the midline. This is the midline. Clear? Mid-sternal line is the midline of the body anteriorly. So heart is present little on the left side. Okay? And it is present superior to the diaphragm. What is the diaphragm? This line is representing diaphragm. You can see diaphragm is a little higher on the left side because from below you can see this is the position of liver. So liver has pushed the diaphragm upwards on the right side. So the heart is lying on the diaphragm, and anterior to the heart is sternum, posterior to the heart is the vertebral column. Clear? Here also you can see anteriorly there is sternum, posteriorly there is vertebral column, and heart is lying in the mediastinum. Which mediastinum? The inferior mediastinum. And in the inferior mediastinum also it was classified into anterior, middle and posterior mediastinum. So the heart is lying in the middle part of the inferior mediastinum. Okay, understood? Now you can now here see we have a little pushed away the two lungs which were covering it anteriorly. This is the right lung, this is the left lung, and you can see the margins of the pleura. The pleura is nothing but the covering of lungs. This is the right lung. It has got three lobes, 1, 2, 3. Clear? On the left side we have got the left lung which has got two lobes. This one lobe, second lobe. You can see the fissure here. Clear? And when we have removed we have separated, pulled apart the right and left lung, we can see the anterior aspect of the heart. Okay? Where you can see fat also, this yellow color is fat, and we are seeing the blood vessels here. These blood vessels are nothing but the coronary blood vessels, to which we will come later on. Now, first of all, like every organ, heart also needs a covering. So the covering of the heart is called pericardium. Peri means all around. Cardium means the heart. So pericardium. What is pericardium? It is a double walled sac around the heart. Okay? Pleura was also double layered. Pericardium is also double layered. So it has got two layers. The superficial layer is fibrous pericardium. The deep layer is visceral pericardium or serous pericardium. It is again divided into two parts. One is the superficial, and that means the outer layer, and the deeper layer means which is more close to the heart. So the outer one is called parietal layer of serous pericardium, and the inner one means the layer of pericardium which is closer to the heart is called visceral layer of serous pericardium. This is clear? And because it has got two layers, the visceral layer also forms the outer wall of heart. Between these two layers we will find a fluid, and that is called pericardial fluid. Pericardial fluid which is minimal in amount. But if it is more, then what is the condition going to come? Pericardial effusion. it can also, this pericardial cavity can also contain blood, and in that case we can see cardiac tamponade. Okay, but presently remain content with the word that the pericardial cavity is filled with a fluid called pericardial fluid. Now, like every organ, everything in the nature, there should be some function of the pericardium. So what is the function? Number one, it protects and anchors the heart. Clear? Protection दे रहा है वो, anchor कर रहा है, रोक के रखा हुआ एक जगह. It prevents the overfilling of the heart with blood. तो कौन इसमें काम कर रहा होगा? The fibrous pericardium. Because it is fibrous in nature, so it's not going to allow the heart to expand too much. And if the heart expands too much, it's called congestive cardiac failure. Clear? Third function is it allows the heart to work in a relatively friction-free environment. And how this is done? By the presence of pericardial fluid. So these are the three functions of pericardium. Now see the pericardium. This is the fibrous pericardium. You can see the fibers coming from here. So this layer, this thick layer is called fibrous pericardium. And the visceral serous pericardium is of two walls, right? This you can see. From here I will begin. Just follow the pointer. Okay? So this is the outer layer, this is the inner layer. And this is the space, which is the pericardial space, which is filled with fluid. This is outer, so it is called parietal layer of serous pericardium. This is the inner, that means closer layer to the heart, the layer which is closer to the heart. So it is called visceral layer of serous pericardium. Now here you can see these are also the walls of heart. So this layer, the visceral layer of serous pericardium, will be called epicardium. Epi means above. This is the myocardium. You can see the cardiac muscles here. And one more layer, you can see a thin layer. This is the endocardium. And this is the cavity of the heart, cardiac cavity, which is definitely lined by nothing else but the endocardium. So the heart wall is formed by epicardium, myocardium, endocardium. Epicardium is nothing but visceral layer of pericardium, serous pericardium. So the heart wall, it is made up of epicardium, myocardium, endocardium, and in the myocardium we will find fibrous skeleton of the heart because it has to get some strength. And how is this fibrous skeleton formed? It is formed by the crisscrossing, interlacing layer of connective tissue. Now, when we see the heart from the anterior aspect, as we saw in the first diagram that I showed you about the heart, we are looking from the front, from the anterior side, means the anterior view of the heart. What we will see? We will see major vessels of the heart. Okay? Also, we will be seeing the vessels which are supplying the heart, that means the coronary vessels, the branches of the coronary vessels, as well as the veins which are draining the heart itself. So first of all, the major vessels. So first of all, vessels which are returning blood to the heart. We will see the vessels which are returning blood from the body to the heart. Okay? And what are those? Very simple. Superior inferior vena cava, which we are going to find on the right side. Right and left pulmonary veins. The pulmonary veins are 4 in number on the left side because they are going to bring oxygenated blood from lungs, and superior inferior vena cava are going to bring deoxygenated blood from the body, and so they are going to open in the right side of the heart. Next large vessels that we will find is the vessels which are conveying blood away from the heart, means the vessels which are taking the blood away from the heart towards the body. First of all, pulmonary trunk, because we talked about superior inferior vena cava, the vessels which are bringing the deoxygenated blood from the body to the right side of the heart. So when we talk about the large blood vessel taking blood away from the heart, we will talk about the right side first. So right side, on the right side you will find pulmonary trunk, which splits into right and left pulmonary artery, and this is going to start from the right ventricle. Then we talked about right and left pulmonary veins coming on the left side of the heart, the left atria. So what will go out from the left ventricle? Ascending aorta. It has got three branches: brachiocephalic artery, common carotid artery, subclavian artery. Okay, so these are the large vessels which we can see from the front or the anterior view of the heart. Now, as I told you, in the anterior view we will find the large blood vessels which are bringing blood from the body to the heart and which are taking away the blood from the heart to the body. But we will also see the blood vessels which are supplying the heart. The arteries which are supplying, we call it coronary artery and their branches. We will find the tributaries of veins which are going to drain out the venous supply of the heart. What are these? From the anterior view, mind it, we are talking about the anterior view, what we will see in the anterior view. So anteriorly, the arteries which are supplying the heart itself, right and left coronary artery. And where are we going to find them? We will find them in atrioventricular groove, means the groove between right and left atria and right and left ventricle. That is atrioventricular groove. Okay. Then its branches, we will find marginal artery, circumflex artery, anterior interventricular artery. The name suggests anterior interventricular artery means this is going to be present in the anterior interventricular groove. That means between the right and left ventricle. Okay. Veins. What veins of the heart itself we are going to see from the anterior aspect? Small cardiac vein, anterior cardiac vein, great cardiac vein. Again, this great cardiac vein is going to be present along with this anterior interventricular artery. That means in the anterior interventricular groove. Now, this is the anterior view of the heart. Now, this is the anterior view. First of all, we talk about the major vessels. Okay. What did I tell you? The major vessels from the right side. Okay. In the right atria, the veins, the large veins which are going to open are superior vena cava, inferior vena cava. Clear? It's so simple. And the veins which are going to open on the left atria are, you can see this red color to here. These are nothing but right and left pulmonary veins. Why they are marked red in color? Because they are containing oxygenated blood. So this is about the major veins which are bringing the blood from the body towards the heart. On the right side, superior inferior vena cava. On the left side, right and left pulmonary veins. And you can see there are 2 on the right and 2 on the left. That means total 4 pulmonary veins. Don't forget this. Now, the arteries. Arteries are going to arise from the ventricle. So, from the left ventricle, you can see this arch of aorta coming out. And these are the 3 branches that we talked about. First one is brachiocephalic artery. Clear? The second one is left common carotid artery. Common carotid artery means it is going to divide into external and internal carotid artery. And the third one is left subclavian artery. Clear? So these are the three branches of arch of aorta. Okay. So this is the ascending aorta, this is the arch of aorta, and then after that we will have descending aorta. In the thoracic region it will be called thoracic aorta, in abdomen it will be called abdominal aorta. Clear? So this is from the left ventricle, and from the right ventricle this is the right ventricle. See, from the right ventricle we are seeing pulmonary trunk. Okay, pulmonary trunk. Pulmonary trunk has to divide into two arteries because it has to give one branch to the right lung and one to the left lung. So this is the right pulmonary artery and this is the left pulmonary artery. Again see, we are saying that this is artery but it is blue in color, just like superior inferior vena cava. Yes, because it is taking the deoxygenated blood which was brought to the right side from superior and inferior vena cava. So these were the large vessels which were bringing blood from the body to the heart and which were taking out the blood from the heart to the body. Clear? Now we come to the arteries and veins of the heart itself. Now see, this is auricle. Okay, this flattened area. This is the right auricle, this is left auricle. These are the vestigial part of the right atrium and left atrium. This is right ventricle, this is left ventricle. So from the diagram itself you can see that from this right ventricle is present anteriorly and left ventricle is present little less anteriorly and most of it is present posteriorly. Okay, and between the atria and ventricle you will have this atrioventricular groove. Atrioventricular groove. This is the right atrioventricular groove. This is the left atrioventricular groove. Here is the right coronary artery and this is the left coronary artery. But now they will give the branches. What is the branch? You can see this is present here on the margin. So we will call it marginal artery. So marginal artery is a branch of right coronary artery. Then we can see one more branch coming over here on the surface of the anterior surface of the right ventricle to supply the muscles over here. Then this is the left coronary artery. It is very small in size. It is giving one artery which is called circumflex artery, because circumflex artery is always going to anastomose. So it is going to anastomose behind with this right coronary artery on the posterior aspect. Then one more branch of the left coronary artery is here between right ventricle and left ventricle. Clear? So what is this area called? Interventricular groove. But which one? Anterior. Anterior interventricular groove. So this artery which is lying in the anterior interventricular groove is called anterior interventricular artery. The name of the groove is anterior interventricular groove. So the artery is also going to be the anterior interventricular artery. So these were the arteries which we can see from the anterior view of the heart, which are supplying the heart muscle itself. Now the veins. We will start from the marginal artery side. From here you can see one small vein here. This is small cardiac vein because it is a small in size, isn't it? So this is the small cardiac vein. You can see the tributary. Again it is going upwards, right? Then you will see one more vein over here, so which is present on the anterior aspect of the right ventricular surface. So this is anterior cardiac vein. So this was the marginal cardiac vein, this is anterior cardiac vein, and what is this large vein called, which is lying in anterior interventricular groove. So because it is large, we call it great cardiac vein. Clear? So these were the large blood vessels which were coming towards the heart, which were going away from the heart. These were the arteries which were supplying the heart and which were draining out the blood of the heart itself. Okay. Now we see the heart from behind, the posterior view. Again, the large blood vessels. Large blood vessels, the vessels returning blood to the heart. Again the same, they are not going to be any different. On the right side, superior inferior vena cava. On the left side, right and left pulmonary veins. Similarly, the large vessels conveying the blood from heart to the body, they are also going to be the same. On the left side, aorta. On the right side, right and left pulmonary arteries, which were the branches of pulmonary trunk. They came out from the right ventricle. So the large vessels are going to be the same. The only difference is going to be in the cardiac vessels, the vessels which are supplying the heart and the veins which are draining the heart. So what are the cardiac vein arteries that we are going to see? First of all, in the atrioventricular groove on the right side, we will see the right coronary artery, but we will not see the left coronary artery. It was very small in size, but its branch will be there. Its branch was circumflex artery. From it is going to arise the posterior interventricular artery. The name itself suggests it is going to lie in the posterior interventricular groove. Clear? So these are the two arteries that we will see on the posterior side of the heart, the arteries which are supplying the heart itself, the blood supply of heart. Now the veins. Great cardiac vein, which was present anteriorly, isn't it, in anterior interventricular groove. It is going to come a little backwards too. So we will find its terminal part over there. Then the posterior vein to the left ventricle. The middle cardiac vein. Middle cardiac vein is a counterpart of the great cardiac vein. In the anterior interventricular groove, we found great cardiac vein. In the posterior interventricular groove, we will find middle cardiac vein. And all these veins that we have read about, which are draining the heart, they are finally going to drain in this coronary sinus. And coronary sinus will open in the right atrium, just like superior vena cava, inferior vena cava, because all the deoxygenated blood of the body is going to be drained in the right atria. Now we will see the heart from the posterior aspect. See here. You can see superior vena cava here. This is the inferior vena cava. Now this is the arch of aorta. Its three branches, isn't it? Brachiocephalic artery, common carotid artery, subclavian artery, left subclavian artery, right? The same thing that we saw from the front. The only one difference is there. We find here right and left pulmonary arteries, and in the front we had found pulmonary trunk, but here they have divided into right and left. Here see, you are seeing more clearly the four pulmonary veins, isn't it? Two from the right side, two on the left side. So these were the major blood vessels which we also saw from the anterior aspect. We are seeing it more clearly on the posterior aspect. Now we come to the blood supply of the heart itself. Now see here. This is the right side. This is right atrioventricular groove. Clear? So from here we are seeing the right coronary artery. But here on the left side we are seeing the circumflex artery, which is going to anastomose here. Then we find here posterior, because this is the posterior aspect and this is the posterior interventricular groove. This is the left ventricle, this is the right ventricle. So here the artery is posterior interventricular artery because it is present in the posterior interventricular groove, and the vein which is accompanying it is middle cardiac vein. As I've told you, the counterpart of this middle cardiac vein on the anterior aspect was the great cardiac vein. We will find one more vein here. What is this? Posterior vein of left ventricle. Just like on the anterior aspect, when we saw the anterior aspect, the anterior surface of the right ventricle was drained by a vein, isn't it? So here it has to be also drained. And finally what we find, this thickened structure. All these veins are coming and draining here in the coronary sinus, including this great cardiac vein itself. This coronary sinus is the last vein of heart, which will enter the right atria, and it will be covered by a Thebesian valve. Here in the interior, if we get a section of the heart, we will see this is the wall between the right and left ventricle. So this is the interventricular septum. We find lot of congenital anomalies where there is a hole in this septum, isn't it, when it is not formed fully. Similarly, there is an interatrial septum. There also a hole can occur. So that is also a congenital anomaly. In that case, in both these cases, the blood from the right side gets mixed up from the left side, and so the blood which should be deoxygenated on the right side and oxygenated on the left side becomes mixed up, and the person has a lot of problem like breathlessness, cyanosis, isn't it? Now, here you can see one thing that I want to show you. First of all, this is the atria, okay? This is the left side, the left atria, which has got this opening of the pulmonary veins, and this is the valve on the left side. The valve between left atria and left ventricle is called bicuspid valve or mitral valve. On the right side, this is the right atria and this is the right ventricle. The valve here are tricuspid, means there are 3 cusps there, and they are always allowing a unidirectional movement that can only come from atria to ventricle. It cannot go back. If it goes back, that is a pathology, that is insufficiency of the valves. So how this is happening? You can see papillary veins are there. From the papillary veins are arising chorda tendini, and they are attached to these valves. So the atrioventricular valves on the left side are called bicuspid or mitral valve, on the right side tricuspid. Now what about the valves between the ventricles and pulmonary trunk and aorta? They are all same, semilunar valve. Those semilunar valve are between right ventricle and pulmonary trunk. Semilunar valve are between left ventricle and aorta. Okay, so these were the valves, and you can see how thickened muscular valve is present in left ventricle, because the left ventricle has to pump the blood to the whole body, systemic circulation, isn't it? Now, atria of the heart. Atria are the receiving chambers, as you know. Each atrium has a protruding auricle that you saw, the purple colored. Pectinate muscles mark the atrial valve. Blood enters the right atria from the superior and inferior vena cava, and also the coronary sinus. That means all that deoxygenated blood is going to enter the right atria. Blood enters left atria from pulmonary veins, and we saw that the pulmonary veins were colored red because it contained oxygenated blood. Ventricles of the heart. Ventricles are the discharging chambers of the heart. means the chambers which are going to send away the blood from the heart towards the body. Papillary muscles and trabeculae carni muscles, they mark the ventricular wall. Right ventricle pumps the blood into pulmonary trunk. Left ventricle pumps the blood into the aorta. So it's so clear because the right side is receiving the deoxygenated blood. So the blood from the right side has to go to the lungs for oxygenation. And the left ventricle is pumping to the body because the left side of the heart is receiving the oxygenated blood. And so the function of the left ventricle is going to be to send the oxygenated blood to the whole body. This also you know, the first of all, the right atrium is receiving the blood. Which blood? Deoxygenated blood. Then it has to pass through tricuspid valve. Then the blood will reach the right ventricle. From the right ventricle, through the pulmonary semilunar valve, the blood will reach the pulmonary artery. And from there to the lungs. In the lungs, oxygenation will happen. And so from the lungs, after that function, the blood has become oxygenated, the carbon dioxide has been removed depending on the partial pressure of the oxygen and carbon dioxide in the blood. Then through the pulmonary veins, this oxygenated blood, it will reach the left atrium. From the left atrium, it has to pass through the bicuspid or mitral valve. And then the blood will reach the left ventricle. From the left ventricle, now the function of the left ventricle is to supply the oxygenated blood to the whole body. So through the aortic semilunar valve, it will reach the aorta. And the aorta will finally give the systemic circulation, means it will give circulation to the all systems of the body. Clear? Now here you can see everything marked in the blue is containing the deoxygenated blood, the red is containing oxygenated blood. This is the right side of the heart. Right atria is receiving all the deoxygenated blood. Right ventricle is sending off the blood for oxygenation through the pulmonary trunk to the lungs. In the lungs, the blood is getting oxygenated and then returned back to the left atria. From there it goes to the left ventricle. Left ventricle through this aorta sends the oxygenated blood to all the systems of the body, where after metabolism the blood becomes deoxygenated, and again this cycle continues like this. Clear? Now the coronary circulation, as you already know,